Many women believe heavy periods and pelvic pressure are just part of being a woman. But sometimes the real cause is something called fibroids, which affect millions of women worldwide. Many will have them right now without knowing. Others will spend years dealing with heavy periods, pelvic pain, bloating, and fatigue, and never be told why. Today we are talking about uterine fibroids, what they are, why they form, what they mean for your health, your periods, and your fertility, and what you can actually do about them. What are fibroids? Uterine fibroids are non-cancerous growths that develop in or around the uterus. They are made of muscle and fibrous tissue and can range in size from as small as a pea to as large as a melon. The medical term is uterine leiomyomas or myomas. But fibroids is what most people call them. Here is what is important to understand right away. Fibroids are almost never cancerous. Less than 1 in 1,000 fibroids is malignant. They do not increase your risk of uterine cancer. Some women have one fibroid, others have multiple. They can be tiny or very large, and they can grow slowly over time, or not at all. Types of fibroids. There are 4 main types of fibroids, and the type depends entirely on where they grow inside or around the uterus. Intramural fibroids grow within the muscular wall of the uterus. They are the most common type and can cause the uterus to appear larger than normal. Subserosal fibroids grow on the outside of the uterus, on the surface. They can grow very large and sometimes press against nearby organs like the bladder or bowel. Submucosal fibroids grow just beneath the inner lining of the uterus. They are the least common type, but often cause the most noticeable symptoms, particularly heavy bleeding. Pedunculated fibroids grow on a stalk, either inside the uterine cavity or on the outer surface. They can twist on their stalk, which causes sudden, sharp pain. Now, what causes fibroids? The exact cause of fibroids is not fully understood, but researchers have identified several key factors that contribute to their development. Hormones play the biggest role. Fibroids are sensitive to estrogen and progesterone, the hormones that regulate your menstrual cycle. They tend to grow during reproductive years, when these hormones are high, and shrink after menopause when they drop. Genetics also matters. If your mother or sister had fibroids, you are significantly more likely to develop them too. Race is a notable factor. Black women are 2 to 3 times more likely to develop fibroids than white women, and tend to develop them at a younger age and with more severe symptoms. The reasons are still being studied, but it is important to name this because it means Black women need to be especially aware. Other contributing factors include obesity, vitamin D deficiency, and starting your period at an early age. Symptoms of fibroids. Here is something that surprises many women. A large number of fibroids cause no symptoms at all. They are found during a routine scan, and the woman never even knew they were there. But when symptoms do occur, they can significantly affect your quality of life. The most common symptoms include heavy or prolonged periods, sometimes with large clots, pelvic pain or pressure, bloating and a feeling of fullness in the lower abdomen, frequent urination if a fibroid is pressing on the bladder, pain during sex, lower back pain, and in some cases, difficulty getting pregnant. If you are experiencing periods so heavy that you are soaking through pads or tampons rapidly, passing large clots, or feeling faint, please see a doctor. That level of blood loss can lead to anemia, and it needs attention. So, how are fibroids diagnosed? Fibroids are usually diagnosed through an ultrasound scan, either abdominal or transvaginal. Your doctor may also recommend an MRI scan to get a clearer picture of the size, number, and exact location of any fibroids. Blood tests may be ordered to check for anemia if you have been experiencing heavy bleeding. In some cases, a hysteroscopy, a small camera inserted through the cervix, is used to examine the inside of the uterus directly. If you suspect you have fibroids, or if your periods have changed significantly, you have every right to ask your doctor for a scan. Do not wait for symptoms to become unbearable before seeking answers. Treatment options for fibroids. Treatment depends on your symptoms, the size and location of your fibroids, your age, and whether you want to have children in the future. Watchful waiting is appropriate for fibroids that are small and not causing symptoms. Regular scans to monitor them is all that is needed. Medication can help manage symptoms. Hormonal treatments like the combined pill or hormonal IUD can reduce heavy bleeding. GnRH agonists can shrink fibroids temporarily, often used before surgery. Non-surgical procedures include uterine fibroid embolization, which cuts off the blood supply to fibroids, causing them to shrink, and focused ultrasound therapy, which uses sound waves to destroy fibroid tissue. Surgery options include a myomectomy, which removes fibroids while preserving the uterus, and a hysterectomy, which removes the uterus entirely. A hysterectomy is the only permanent cure for fibroids, but it is a major decision and should be considered carefully with your doctor. Fibroids and fertility. This is the question many women are most afraid to ask. Can I still get pregnant if I have fibroids? The honest answer is, most women with fibroids can and do get pregnant without any problems. The majority of fibroids do not significantly affect fertility. However, some fibroids, particularly submucosal fibroids that distort the uterine cavity, can make it harder to conceive or carry a pregnancy to term. In these cases, removing the fibroid before trying to conceive may significantly improve outcomes. If you have fibroids and you are planning a pregnancy, talk to your doctor or a specialist. Understanding the type and location of your fibroids helps your care team advise you properly. During pregnancy, fibroids sometimes grow due to increased estrogen. Most pregnancies with fibroids progress completely normally, but your care team will monitor you more closely. Fibroids are incredibly common. They are not a death sentence. They are not a sign that something is fundamentally wrong with you, and you are absolutely not alone. What matters now is that you are informed. You know what fibroids are, you know the symptoms to watch for, you know what to ask your doctor, and you know that treatment options exist. Your body deserves honest answers. Now you have them. Subscribe. Real Women's Health, no shame.